Hello, hello, hello. My name is Manelia Plummer. I am the founder and CEO of this podcast, Everything PT. I'm currently working in an outpatient clinic on my way in school at University of Central Florida, UCF, shout out to the Knights, to become a DPT. As you guys may already know, it is the third episode. So we're going to start with an icebreaker question. An icebreaker question of the day is, if I could be a bone, what would I be? I've had a lot of time to think about this question. I'm not going to lie to you guys. I've had a lot of time to think about this question, and I feel like there's only one right answer to this question. It's unique. There's none like it. It's high key, low key, a very important bone, but it's going to be the scapula. Not only is it unique, it holds the muscles that stabilizes the shoulder. I work with so many rotator cuff repairs and rotator cuff, injuries that I've just have had to learn so much about the scapula. Like, if you've ever torn the rotator cuff muscle, strengthening those muscles are probably one of the most important things to do. So I'm going to go for the scapula. I'm not changing my answer. It wasn't a hard question. It wasn't a hard question at all. All right. Let's get into it. Episode 3, we're going to be talking about treatment styles, what you can expect from me as a PTA and how I treat as a PTA, and just some tips that can overall just make you a better therapist. So first things first, let me set up this case scenario. Let's say there is a patient. We're going to call this patient Sally. Sally has done her initial evaluation with the DPT, and now she's on her way to seeing me, let's say in the next 2 days. So first things first, when I pull Sally back, right, let's just say she has a lumbar issue. So this is basically what I'm going to do. I'm going to pull her back. I'm going to point her to a seat that she can sit in and kind of get comfortable. I'm going to tell her, hold on, hey, just hang out for a little bit. I'm going to go grab a hot pack. Put it on it. This is what I call the butter up stage, y'all. We are buttering them up to basically get them to come back to us, to get them to come back to me. You know what I'm saying? So when I put that hot pack on, I want to sit in a stool. I want to let her know that I read the note. Right? So I might say, hey, Sally, I saw that you were having such and such pain going down the right leg. How's that pain been going? Did such and such give you any HEP? Do you feel like that pain's getting better? Has it been about the same since, you've started the physical therapy? So boom, I'm letting her know that I know who she is. I know what she's dealing with, and that I've talked to the DPT that performed that initial evaluation. And all this is doing is pretty much building that trust with me. She's not just coming back to a random person that doesn't know anything about her, right? So if I can give you any advice as a therapist, make sure you know what's going on with that patient before you pull them back. Don't pull them back and try to go through the note and say, what do you have going? Can you remind me, what do you have going on? They're losing confidence in you at that point, y'all. So you want to make sure you're reading those notes. You want to make sure you are highly educated on what they have going on. That way they can be comfortable and trust you that you're going to execute the procedure and the exercises to get them better. First impression is everything, y'all. First impression is everything. The patient's first impression of you should not be you fumbling around trying to figure out what's going on with her when you could have read that note before you pulled her back. Okay. For me personally, if I was Sally, I would be like, this person don't know what's going on with me. I'm slowly losing confidence that you can execute me to a better place. I'm losing confidence in you. So you want to make sure you're educated before you pull them back. Even if you take the time to read the note and pull them back 3 minutes later than what their time is. I prefer that than for you to bring them back and fumbling and trying to, figure out what they got going on, y'all. You want to make sure you're confident in what they got going on. Be confident. Be confident. And in order to be confident, you got to know what's going on. You have to know what's going on. And another reason you want to be confident is because you kind of are at two disadvantages. Disadvantage number 1 is the lack of continuity. They just did an initial evaluation with another therapist, and now they already have another therapist. And then disadvantage number 2, for me personally, because I am a PTA, is I am a PTA. So when you go from being with the doctor to being with the assistant, it just doesn't sound the best. So because you have those disadvantages, you need to be strong in those other things that we just talked about. All right, so moving forward, I have Sally, I have her back, and she's on the hot pack. We've identified that I know what she got going on. And I tell people this all the time, y'all, and I'm so serious. Like that first treatment session is like a first date to me. Because I want to get to know you. I want to get to know what do you do in your free time? What am I getting myself into? What do I have to get you back to? I can't get you back to your prior living of function if I don't know what your prior living of function is. So if I am amongst a basketball player, I need to know that they're a basketball player because I need to know what we're rehabbing back into. If I am rehabbing a pickleball player, right, and you have not been able to play the very thing that you love because of this back pain, I need to know what kind of movements, I need to know what kind of things I need to be implementing as a therapist to get you back to where you want to be, where you desire to be. And anybody that plays those recreational sports, you have to know that they love it, right? I have a piano player at the moment, and she's having trouble getting that abduction, having that strength for it. Those are things that I need to be implementing in therapy so that she can get stronger to do the thing that she loved to do the most. Because that's really what it's about, getting them back to their prior living of function. So ask those questions, y'all. It's like a first date. Not only are you asking these questions to get them back to prior living of function, but these are small tips that you can put in your back pocket, right? So let's say, I'm asking Sally, hey, what do you like to do for fun? Do you have any children? Whatever the case is, if she tells me she has one daughter that she dearly loves, right? I put that in my back pocket. And the reason I put that into my back pocket, because those are the things that she's going to love to talk about, right? And I'm also creating this atmosphere of fun. I'm creating this atmosphere of you're comfortable to talk to me, and I'm creating this atmosphere of trust, right? So let's say she comes in the fourth and fifth treatment. Hey, how's your daughter doing? Those are things that you put in your back pocket so that you can ask questions and become more engaged and more involved in your therapy as a therapist, okay? So again, y'all, we have to be involved. And this is just my personal belief, my personal standby on it. I've had a DPT tell me it doesn't take all that. And that's okay. This is my style and this is how I treat. Because before I'm a therapist, y'all, I'm a Christian. So all these things that I'm talking to you about, it's not that it's strategically planned. This is just how I live my life on a regular basis. I really am involved, and I'm really concerned about you, how you're feeling, how's your daughter feeling. Those are just the things that I love asking because I genuinely care about people, okay? If you tell me that your son was in the hospital, there's no way I can't follow up with that in the next treatment. Okay, so let's say, boom, they're on the hot pack. We've gotten to know them. We've asked them questions. What do you love to do? We've gotten to know a little bit about them. Now they're kind of getting into this place where they're starting to trust us. And then I'm going to take it a little bit more further, right? So now I'm going to get my hands on them. So let's say Sally, again, we already identified that she's a low back pain patient, right? So after the hot pack, we might do a couple of stretches, but eventually I'm going to get her on the bed, prone or, whatever positions that she can tolerate. And I'm going to ask her, where does this hurt? And it's not because I don't know where it hurts, because I have a note from the initial evaluation that tells me where it hurts. I have a detailed note that tells me that she has myofascial trigger points in her piriformis. I have a detailed note that tells me she has hypertonicity, in her glutes. I have a detailed note of that. But I want to take it further so that she feels like, not only that she feels like I care about her, but I want to see for myself where this pain is. And this is just taking it to the next level of, I'm really concerned about you. This is what that says to her, it's what it will say to me. Like if I had a therapist sit me down and say, okay, is this where your pain is? And really identify it that way. That will make me feel so much more better that you are concerned about me and that you do care about me and that you do care about this pain that I'm having. Secondly, therapists, people that are seeing these patients for the first time, you want to get your hands on them. Physical therapy is so much about therapeutic activities, therapeutic exercises. It is like you're coming to a gym and working out. But people want you to put their hands on them, okay? Without a doubt, they're paying for that, okay? And it's something that you don't have to do all the time, but I'm just really recommending that you do that for that first time, for that second time. If they are having sciatic nerve pain, did you check the piriformis? Are you putting a Theragun into it? Are you putting your elbow into it? Like, those are things that I personally feel like should be done. So that way, and again, I think we talked about this in that last episode 1 actually, where 30% of sciatic nerve pain patients, that piriformis syndrome is the cause of that. So if you address that piriformis syndrome, you can probably help their sciatic nerve pain. So if Sally's a sciatic nerve pain, that is something I'm definitely going to get in and try to do to see if that is the reason she's having her pain. We're going to stretch that and do all that great stuff. So that's definitely going in that first treatment. Okay. All right, you guys. And another thing that's happening in this first initial treatment outside of the initial evaluation is education. It is so important to educate your patients about what they will be feeling, what to expect, y'all. I tell my patients all the time, like, this first couple of weeks are probably going to be rough. You know, we're taking your body outside of its comfort zone. You've probably been guarding and avoiding movement. And here we're going to be doing those movements. And of course, in moderation. But so you're going to be sore. That's something that comes with the game. I use that all the time. It comes with the game. It comes with the game. But I also give the guardrails of, but I don't want you sore and in a ton of pain. So if that person comes to me that next treatment and they say, man, I couldn't sleep that night, I was in so much pain, I want to dial it back. I want to dial it down, okay? Because I don't want you to feel like physical therapy is going to be this thing that is going to give you excessive pain. I don't want you to associate therapy with that. Do I want you sore? Yes, of course. I definitely want you sore. This is also a great time for you to explain to them the difference between different pains. Soreness is the act of muscle building up and breaking down. Pain is different from soreness. So we want to be able to address these things and identify these things early on. That way you don't have a patient come back and say, oh, I was in pain, I was in pain, I was in pain. And the pain wasn't really pain, it was just soreness, which typically is what we want. We want to build muscle if that's one of the goals. Like, we want to build those muscles around that injured area. So this is a great time for you to educate your patients. Hey, you're going to be sore after this. Hey, you might be in a little bit of pain after these first 2 weeks, but it will start to get better as your body is more comfortable with moving. Like, those are the things that you want to educate. Hey, your HEP is going to be 80%. Your home exercise program is going to be 80%. You scare them. Of course, it's not 80%, but this is where you scare them. It's going to be 80% of your rehabilitation. You have to be doing these things at home, or else you won't get the prognosis that you want. So this is, again, a great time to educate them, y'all. Educate them on the muscles. Pull out Bob. Bob is a skeleton that we have in the office. Pull him out. Let them know this is where your pain is happening at. Because the more they get an understanding of their pain, why they're having that pain, the more that they could do things to prevent that pain, right? And, you know, for me personally, and I tell my patients this all the time, the more you know, the better for me. The more I educate you, the better it is for me. The more you know what's going on in your body, the better for me. Okay, so that's something I always love to educate my patients on. Again, just using that soreness thing as an example, but your patient should be able to identify the difference between soreness and pain. Your patient should be able to identify that soreness is the act of building muscle. And if they can't identify that, then they're always going to associate soreness as a bad thing. And it's not. It's not. I want you sore after treatment, at least a little bit. I don't want you sore for 6 days, but I want you to be a little sore because we're building muscle. That means we're on the right path. So now they associate soreness with muscle building, and it doesn't have this negative cloud around it. Okay, so education is very important in that first treatment, and I'm doing that all throughout treatment from beginning to end. And even at the end, I'm asking, hey, do you have any questions? And in Spanish, preguntas. You got questions? What's up? Let me know. Because again, the more you know, the better it is for both of us. And then 2, I'm not going to go all out on this first treatment, y'all. I don't know what Sally's tolerance is. And you don't want to get to a place where you're giving out now all kinds of squats and stuff. And Sally is this 93-year-old woman, and you're just completely killed her. Like, I'm telling you, she probably ain't going to come back to you. And this is just personally me. I keep it conservative in that first treatment. I'm putting on the hot pack before and after treatment. I'm giving stretches. I'm doing things that I'm going to give you for your HEP. I'm also going to get my hands on you. We're going to do manual therapy. And all that is probably going to take up those 60 minutes. I'm not going to do a ton of strengthening. I might do some small strengthening like posterior pelvic tilts and stuff like that. Very minimal bridges, pain-free bridges, but nothing crazy. We will gradually build up to the crazy. We will gradually build up to the real me. But in this session, we buttering you up, okay? But eventually, as you get to that 10th and 12th visit, yeah, we'll do some squats. Yeah, we'll do some sit-to-stands, depending on your level of function. The other day, I had this painter. You guys, this is so funny. Like, listen, if you're a painter and you go up a ladder, if we got a ladder in the clinic, we're going up the ladder, y'all. Like, so the other day, I have this guy, he's a painter, and, I'm asking him, he's from Belize. Is he from Belize? I can't remember where he's from, but he's from somewhere, y'all. He don't speak no English. Like, he speaks no English, y'all. And I'm like, asking him what he's doing, what he does. And he's, we eventually get to a point where he tells me he's a painter. And I was like, okay, so I'm asking him, like, what do you do on your job? He let me know he goes up the ladder, he comes down the ladder, he's holding stuff while he's on the ladder. And I'm like, Bing, we got a ladder back there. So I go get the ladder, I put the ladder up, I'm holding the ladder, and I watch him go up and go down. Hey, give me 10 of those. And okay, so this isn't the first treatment, but this is just kind of letting you guys know, like, eventually we will get back into this stuff. But I didn't do that the first treatment. We were like on our 5th treatment, 5th or 6th treatment, and he's pretty strong. But I gave him 10 of those, go up the ladder, come down the ladder, give me 10 of those, because I want to get you back to your prior living and function. And if I don't ever pull out the ladder and get you up the ladder, down the ladder, how do I know you're able to do that? You know what I'm saying? So I want to do those things. I want to, when it comes to functional strength, man, I love it. I love my workers' comp patients, y'all. Best believe my Amazon drivers and all that great stuff, man, we're carrying boxes. Like, you're really delivering, because that's how I know that you're ready for the real world again. I can't distinguish if you're ready for that if I never do it in treatment. And I do know that there is a genre of therapists that don't do this. Y'all got to be able to think outside the box. And that is the thing that, I feel like recently I have been seeing that, there's this stigma of PTAs and DPTs and stuff like that. We don't want to be in that, y'all. Like, we are, again, so important to the community. So we want to keep therapy fun. We want to keep it professional. We want to be able to engage our patients to a level where they feel like, I feel good paying you for this service. Like, I feel good giving you $100 if they were cash based for this service, because I got the maximal optimal care. You know what I mean? And the ways that you do that is you think outside the box with these treatment plans, y'all. Not only did I have, we're going to call him Paulo. Not only did I have Paulo going up and down the ladder, I put weight in his hand, because I know that when he's painting, he's not just going up the ladder. He has to carry his paint up the ladder. So that's something that I also implemented, because he needs that. That is what he's going back to. He's talking about going back to work in the next 2 weeks. and I got to make sure he's able to do that. I saw him the next day. He said he was sore. That's fine. You're going to be sore. So again, like therapy can be very expensive, right? I was just listening to a YouTube video of a man saying that he charges $300 a treat. And I'm like, whoa, like I didn't know cash-based clinics were charging that much. But it's like, if a patient feels like they're getting that optimal care for $300, then so be it, but you got to be able to and willing to give that $300 care. So I do enjoy listening to stuff like that because he has a full house of people that feel like they are getting $300 worth of care. And I appreciate that, man. I appreciate that so much. And then, of course, let's say we're at the end of the treatment. Sally's back on the hot pack again. So we've hit a full 360. Sally's back on the hot pack because I know Sally's going to be sore. She told me that she's been dealing with this pain for a long time. She hasn't been able to do anything about it. We did some LTRs, supine, and we've moved the body, and she hasn't moved the body. So that in itself will let me know that she's going to be sore. And so I put that hot pack on so that she leaves feeling good, y'all. That she's perceived, that she feels good, right? And then boom, she gets home and she is sore, okay? So this is where I'm going to remind her, like, hey, make sure you're using the modalities at home. Make sure you're using the hot pack. Make sure you're using the cold pack when you're feeling sore. And then that next treatment I have with Sally, follow up, y'all. Follow up. Make sure you're in the right scope of intensity that you should be giving her. If she goes home and couldn't sleep for days, you probably got to back it down a little bit just until we can get to that point. But thank you guys so much for tuning in once again. Y'all, I want to give a huge shout out to the person that sets up my podcast stuff, my husband, Aaron Plummer. He is literally my chief editor. He does all of my audio stuff. He is an amazing man, y'all. And today we had a ton of stuff to do, just setting this up, making this look pretty. And I just want to say thank you, honey. But thank you guys so much for tuning in. Don't forget to go over to the YouTube channel, Manelia Plummer. Check out the YouTube stuff. Let me know how you guys feel about it. Let me know what kind of videos you guys want. I am so honored. You passed by so many physical therapy podcasts to be here with me. And I just want to thank you once again. But you guys be blessed, and I will see you guys on the next episode.